You have quite a few supplements to take after bariatric surgery, and one of those is calcium. This question was posted in my Facebook group recently. Is it bad to take my calcium citrate with coffee? I have your answer right after this.
Looking to change up your vitamin routine? ProCare has a new multivitamin soft chew that comes with 3 delicious fruit flavors. With flexible dosing, you can accommodate your whole family's vitamin needs, and it even includes iron. Paired with calcium chews and our new protein powder. Visit ProCareNow.com and use code Susan10 to save 10%.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 102. I'm here to help you cut through all the health hype, give you accurate information worthy of all your time and efforts. Simple, step-by-step strategies that can change your life now so you can get out there and do the things you want to do. This podcast is for you. I want to give a shout out to Heart Aflame for the 5-star review on Apple Podcasts, which said, "This podcast is a must-have for bariatric surgery. I attribute so much of my success to the encouragement, support, accountability, and teaching that you have provided through this podcast." Heart Aflame, my heart is full and happy reading your words. Thank you so much. You know what makes me smile? It's hearing about your success. Well, back to the question. Is it bad to take my calcium citrate with coffee? Well, the thinking used to be that caffeine is a drug that can prevent your body from absorbing calcium the way it should. When you drink coffee containing caffeine, less calcium is absorbed and more is excreted, mainly through urine. Other experts suggest to avoid caffeinated beverages a good 30 minutes before or after you drink or eat food sources that have calcium, or even take your supplements. The estimate for calcium loss has been about 5 milligrams of calcium excreted in the urine for every 150 milligrams of caffeine. So that's about a cup of coffee. Others have suggested 2 to 3 milligrams of calcium are lost per cup. So somewhere in that 3 to 5 milligram range. Okay, here's the deal. Yes, caffeine can slightly decrease calcium absorption, but that amount, 3 to 5 milligrams, is so low. Newer research indicates that the effect is minimal. In fact, a more recent study from the Cleveland Clinic looked at coffee and its relationship to bone health. The study found that people who habitually drank coffee had higher bone density than non-coffee drinkers, and that 3 metabolites in coffee were actually associated with an increase in bone density and a decrease in the risk for fracture. Let's put this in real-world terms for your everyday cup of joe. So don't miss this. Come in close. Listen. Generally, you can offset this slight loss in calcium just by adding 1 to 2 tablespoons of milk to your cup of coffee. But let's say you prefer to drink your coffee black. The latest science says that this moderate amount of caffeine from coffee doesn't negatively affect bone health or increase the risk for osteoporosis if you take in enough calcium and vitamin D through your diet and or your supplements the rest of the day. So one more time, this moderate amount of caffeine from coffee doesn't negatively affect bone health nor increase the risk for osteoporosis if you take in enough calcium and vitamin D through your diet or your supplements, or both together. So speaking of calcium, as a reminder, calcium citrate is better absorbed than other types, such as calcium carbonate. The recommended daily dose after surgery is going to be somewhere 600 milligrams per day, up to 1,200 to 1,500 milligrams per day. And this is where your bariatric dietitian hopefully is providing you with the specific amounts just for your situation. But remember, regardless of how much you take, do so in divided doses of 500 to 600 milligrams at a time. Okay, why is this important? That's because this is the maximum amount, 500 to 600 milligrams at a time, that your body can absorb at one time so you don't waste it. You probably notice calcium is often sold in combination with vitamin D, which helps increase the absorption of calcium from the intestine. You can take vitamin D with your calcium, or you can get vitamin D in your multi. How much vitamin D do you need? Well, the general recommendation is to take 3,000 international units, abbreviated IUs, of vitamin D3 per day. So your dose may be higher depending on your blood test and your surgery. Be sure and look at the supplement facts on the multi or the calcium vitamin D product to see if the vitamin D is indeed in that vitamin D3, which is that preferred form, and then also check to see how much is in the supplement. You have enough on your mind after surgery, right? Calcium and caffeine don't need to be two of those. Remember, you're worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC, all rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.